So see, this is what I got after I took the crown off. This is gingiva just like that, slightly inflamed. So this is not a margin. There were no margins. It was just a topi prep all around, and the distal was just like this, full of food and debris, and there were no discernible margins anywhere at all, except just a little bit right here, but I could see nothing at all. Here the margin, if you were to look at sideways, it was touching the adjacent tooth, so there was no space for me to clean up, or for anybody to clean up the cement, or for the patient to floss. So we took that and then we prepped it. And the preparation, if you were to look at it right next to this, let's close up on it now. So that's beforehand, and this is after the prep. And this is how the sulcus was created with Electrosurge. No cord was packed. And if you see, this crown length was very little. The walls were very short, almost negligible. Here we have full length of the wall all around. There is clearance on the mesial, if you take a look, all around. And the margin is very well defined. Here, I'm showing you. And the sulcus is created using Electrosurge, and the impression was taken without any oozing or bleeding or any moisture. And this tissue will heal up because it was all inflamed beforehand. In about 2 or 3 weeks it heals up very, very nicely. This was a dye that was used by the laboratory. They trimmed away and they exposed the sulcus even more. You see, the sulcus is created 0.5 millimeter all around, and then on top of that, that is where they did a CAD/CAM crown, which fits dead on. There is no possibility of an overhang, undercut anywhere. And here, particularly if you look at the mesial, we have space now for the papilla to come in. And this is how it's supposed to be done, that the margins should be totally delineated. You should be able to see them all around. They're nice and even. There are no spikes in it, and there's no ski jump. And at the same time, without using any cords, we have created a sulcus. Here you could not, in the older model, you could not even pack the sulcus with any cord because the margins were short and you would end up in attached gingiva. Here we went beyond the attached gingiva and we created the sulcus. And in 36 years of doing these kind of preps and using Electrosurge, the tissue grows back within about 3 to 4 days. And in a couple of weeks, you have total coverage of the crown, almost up to here, 3 to 4 millimeter of soft tissue. And that's what I recommend that you do.